Hello, thank you for joining the latest one-on-one episode of video series from Modern Healthcare Custom Media, featuring insights from leaders from across the industry. I'm Maria Castellucci, a content strategist at Modern Healthcare. It's my pleasure to be speaking with Ben Gong, Vice President of Product at eVisit. Ben is passionate about product development and making tech solutions that solve real problems. During this discussion, Ben will share common reasons why so many healthcare organizations are plagued by long wait times, the unique challenges presented in the virtual space, and how to leverage data that can make an impact. Before we get started, I want to thank the sponsor of this video, eVisit. eVisit is the only end-to-end enterprise care delivery platform built for health systems and hospitals. They help healthcare craft modern consumer experiences in care navigation, care delivery, and care engagement, improving margins at scale without sacrificing quality. Ben, I'm so glad to be speaking with you today. Let's dive into our conversation.
Thank you. Excited to be here.
So, as I mentioned in the intro, long patient wait times are a huge challenge for healthcare organizations. Can you talk about some of the common reasons why they occur and why they occur specifically in the virtual space?
Yeah, absolutely. So first off, wait times are always going to be an issue, right? This is something that that if you're going to do a synchronous visit with a physician, that you have to understand. We're comparing to the in-person experience. The average wait time in the US is about 18 minutes. And so that's the challenge, which is why are wait times longer for virtual care? And is there something we can do to drop that? There are a few problems that I think that I want to identify. The first is around, obviously, technology, right? It's very easy to sometimes blame the patient. In the virtual care space, you say, oh, we've got a certain population and they just can't work with this stuff. And I think that's unfair, right? We have to recognize the true challenge, which is that when we're in a virtual care solution, the patient is bringing half of the technology solution, right? This is the first problem, right? So when you walk into an in-person clinic, you're surrounded, I mean, it's a technological wonder, right? Despite their flooring or lighting, like these things are amazing, whatever health system you're part of. When you have a patient bring half of the tech solution, you're going to have hurdles, right? Did they not hit the allow microphone button? Did they block their video settings, right? Do they not understand that when you click on this link, it's going to open up a WebRTC, and like it's not their responsibility to understand or necessarily have to navigate that, but it's a reality that we're in, right? So that's problem number one. Patients bring half of the tech solution when you're in a virtual care solution. The second is that a lot of virtual care solutions today exclude entire care teams. This is a huge problem, right? So if you think about the way that an in-person experience works, it's been this, I mean, it's part of this engine that we've been working on for decades, right? You walk in the door, there's somebody who says, hey, let me show you where you're supposed to go. Let me tell you a little bit about what to expect. If you've been sitting there for a while, I'm going to smile at you, right? Like there's this real human interaction that we struggle with virtual care. If you don't have your scheduler or your office staff or your medical assistant part of the exam, then you're going to have problems, right? Now, I know we're talking about wait times, but this is the first half of the problem, right? So often we're like, oh, good, we've got a solution in place. The doc can just hop on. Well, yes, if the patient is ready, if the patient's technology is ready to go, if they know what to expect, right? And so so that's problem number two, right? Point solutions that exclude entire care teams are going to exacerbate this problem. And the third one is hybrid's tough. Hybrid's tricky, right? But I think that's often a cop-out. I think that the reality is billing through virtual care is tricky. And so when folks talk about like long wait times, sometimes they it's just not at the top of their priority because you can't bill in the same way, or docs aren't convinced that that's how they're going to, or systems aren't convinced that optimizing that is their top priority. So those three problems all contribute to long wait times, and it's something that we've thought a ton about at eVisit, and I think that I'm hopeful. I'm hopeful because there are things that are going on today that can ameliorate that.
Really great start. You really did a great job laying the groundwork of what are the challenges. So let's dive into what kind of data can help solve for long wait times.
Yeah,
And as a follow up to that, is getting access to this data currently a challenge?
yeah. So great question. So this one's let me take the first one. So what type of data do you need in order to address long wait times? You just have to have the data. This is actually the biggest problem, right? Um, and let me point out there are certain solutions out there that are oftentimes very simple, but you give up all of this data, right? You can go to a website and just start a send them a link, and suddenly you're in a two-way video solution, right? You may have Zoom or FaceTime, right? Where docs are like, I love FaceTime. I can just call my patients. And the reality is, I think that is from a product perspective, we're saying this is something that the docs need to have. It needs to be it needs to be one click or zero clicks easy, right? We need to, but you got to be able to capture the data. Most of those solutions I just reeled off, they don't capture the encounter. So let me be clear about that. When I say you're capturing data, you need to capture the encounter, right? So when did the patient schedule? When did the patient log in? When did the patient enter the waiting room? When did the patient get a message from somebody saying, here's what's going to happen? When did the patient help? And then you've got the last step of the stage, which is, well, then the patient got to the waiting room. Like, well, how long did they wait there? That's only one question. You actually have to be able to answer all the other questions in this phase. And on the backside, you have to say, well, then how long were they actually meeting with the doctor? And then were they passed back to a scheduler to reschedule, like to schedule their follow-up? So when we think about data, like we really have to be deliberate and say, let's think about the patient experience from start to finish, and the wait time is one part of it. You have to have a truly a system that can measure the data and that's integrated into the provider solution, right? If you're using a different solution that sends messages to the patient beforehand, or that has a different waiting room than the actual exam room, and the patient has to log out and then log back in, or the doctor has to, somebody's messaging them, or heaven forbid, calling them on a phone and trying to like coach them through their email, right? That's a problem, right? So that's the first question. What type of data do you need? You need encounter level data, and that is actually a platform or solution oriented. On the second side, is getting that data a challenge? Not really. Right? Once you actually have that solution in place, then you can actually grab it, right? Then you can begin to measure these key events and to do optimization, not just for the waiting room, but for everything else along the patient journey. Let me say one more thing on this. I think it's not technically a challenge. It's much more an adoption challenge, right? And so you actually have to understand what the physicians want, what the administrators are trying to do. I think of it, when I say adoption challenge, like read political challenge, right? How do you get folks to actually use virtual tools the way that you want them to, or the way that they were meant to, right? Education, work, right? The technology component of data capture, I don't think is a challenge once you have the right solution in place.
That's a great segue to my next question, which is, okay, you have the data. How can a healthcare organization leverage this data? And then should they consider having a partner to help them in this?
Yeah. So I think there are three areas that are really important for leveraging the data. The first is to drive utilization in existing programs. Pretty much everybody like went through COVID, they did something, and now everybody is saying, well, we've got these programs in place. What do we do with them? We want to keep running them, right? Now they may be physician driven, they may be administrative driven, they may have been crisis driven, right? Whatever they may be. A lot of folks have provider or at least a program in place. So that's the first one, right? Which is, how do you actually, like, how are you using it today? How many visits are you doing? Or, how are you actually engaging with your patients? That's the first one, which is just drive utilization in existing programs. The second way that an org can leverage the data is an identifying strategic market opportunities. This one's a lot harder, but also a lot cooler. I've got a data background. I'm totally a data nerd, and it's something that I think we don't have a lot of reps in the virtual care space as an industry, right? Oftentimes we say, here's our solution. Oh, giant health system. How do you want to do it? But the reality is when you sit down with health systems, they are very clear about some directives, but they don't necessarily have a market level view of what they're doing. Let me rephrase that a different way. So one of the things that we did at eVisit, we took 50 million commercial lives and 100% of the Medicare claims, right? We're talking billions of rows, and we're able to say in Dallas, what is the true telemedicine opportunity for nephrology, for oncology, for behavioral health, right? So this is an opportunity where you can sit down with somebody and say, I know you launched your behavioral health program. That's fantastic. Did you know that your internal medicine opportunity is 10x that? And I think that's something that systems often don't have this data or the capacity to pull it out. And the third one is then to optimize the patient and provider experience, right? These are all linked together, right? You have to start with your utilization. Then you say, what's your opportunity? And the third one is, how do you optimize that? How do you lower your wait times? What is driving patients crazy? What are driving your providers crazy, right? Where they're facing burnout, how do you actually help them have a good experience? And you need that data from start to finish, right? The whole flow, not just the waiting room, not just the scheduling piece, the whole flow in order to optimize the program.
So talking about optimization, I want to dive into that a little bit deeper. So healthcare teams are already inundated with so many tasks and data. You talked about burnout. What advice would you give to leadership teams looking to implement and use this kind of data and make sure it's sustained and impactful and doesn't add to burden?
Oh, I think the first message is have hope, right? I think I said this at the beginning, but the last 2 years have been really tough for any leadership team out there that's listening to this. Thank you for what you're doing. Thank you for sticking with the challenges. These are really tough. Second, I'm drowning in data. Everyone's drowning in data. I call it the not the fog of war, but the miasma of data crumbs, where you're like, I think there's something here. I think there's something here, right? If I could give some advice to leadership teams based on my experience working with folks, it's first off, recognize that the market has changed. We're not going back to what we did before. 2/3 of patients want to continue to receive care in a hybrid environment, but only half of docs feel comfortable in a hybrid environment. So you've got this pressure where patients are saying, we want this, we want on demand, we don't want to sit in waiting rooms, we're not comfortable sitting in waiting rooms, whatever market is, right? We've gotten used, you've trained us on how to use virtual care, we want to continue to do hybrid, right? We're not saying in person is amazing for certain things and is optimal for some things, but for others, not really. Like, we shouldn't go back, right? And many docs are saying, this is a challenge for us. We have to recognize that the market has changed and that we have to deal with this hybrid environment. The second thing that I would say, the piece of advice is identify your top 3 KPIs, toss everything out the window, and make sure you're aligned with your partners. If that's optimizing for billing dollars, be really honest about that. If it's about driving utilization, if it's about launching new on-demand or scheduled programs, if it's about patient wait times or patient experience or measuring physician effectiveness, if it's about market expansion, if it's about market share capture, if it's about patient retention, like whatever it is, be very, very clear about what you're trying to do. It seems elementary, but when I sit down with health systems, there are so many initiatives, so many things. Sometimes we blame it on tasks and so much data, but the reality is get aligned on your KPIs And when that happens, then you can partner with your virtual care solution provider and say, here's what we're really trying to do. We've had the most success with teams that have done this, and it's very clear with teams that haven't actually gone through this disciplined or this activity that requires discipline, that the outcomes are different. We just can't we can't help in the same way. And I think the final point to that is, once you're very clear about those KPIs and what you're trying to do, then you can integrate, right? The best interface for us for eVisit is no interface. We want to disappear. We don't want folks to have to deal with one more thing. But that requires really clear KPIs.
That was really great advice. To wrap up, you talked about some of the experiences that eVisit has had with customers. Can you offer a real world example of how a healthcare organization is leveraging this visitor data to improve patient wait times and satisfaction?
Yeah, absolutely. So let me just, there are a couple examples that come to mind. Let me just give you some context. So eVisit has increased the number of visits that we've done by over 1,000% over the last 2 years. Many people peaked in April of 2020. We actually are continuing to peak. We're 57% up from 2020, right? So we are our goal is, as I mentioned, is to align with what folks are trying to do and help drive those strategic priorities, many of which are grow utilization, right? Drop wait times, right? There's some of the things that I just reeled off. There are a few examples that come to mind. We have one partner that is really concerned about the seamless experience. I think that they have they're really good at what they're doing. So Concentra Telemed is able to is leveraging some of the tools that we have to create the seamless experience from start to finish, and they've been very deliberate about the features that they implement. So they over the past since 2019 they have increased 300% in their virtual care usage, while dropping their operational staffing costs by 20% and dropping their phone call volume by 35%, right? So this is important because these work in concert. If you just increase your utilization, but you're not ready to scale, then you're just going to increase your operational costs, right? Or if you're just managing virtual care basically by calling patients, like this is really hard. Like from the ground, like this is just killing all of the administrative side of care, right? It's just hard to call a patient and then try to coach them through, all the things they have to do. You can't blame the patient, right? You have to meet them where they are and build great software. So let me just give one more example. I sat down next to a care coordinator who was using eVisit. About 27 years old. His name's Carlos. And I watched him as he would pull patients into the visit, explain what was going to happen, help them get into the physician waiting room. The doc would do their exam, and then Carlos would pick back up the phone, or sorry, he'd hop back into the virtual video visit and say, hey, here's what's going to happen next. It was the most like an in-person experience that I'd seen. And it was so painless for the patients, right? The patients didn't have to do anything. They were just able to do their work. The providers were able to do their work. We didn't disrupt their clinical workflow. So I think that there's a lot that we're doing. I'm really hopeful about the future, and I'm really excited about virtual care.
Thank you, Ben. Ben, this was such a great discussion. I really appreciate your time today. I'd like to once again thank the sponsor of this video, eVisit. For more information about eVisit, please visit support.evisit.com. And to our audience, thanks for tuning in today. Look for more one-on-one episodes in the coming months by visiting our website and our social media platforms. Thanks so much.